Ya Ali Madad. My name is Yasin Banji, and I'm a practicing urologist. I'd like to spend a few minutes today discussing health topics of particular relevance for men, including prostate and bladder cancer and benign prostatic enlargement. Prostate cancer is one of the most commonly diagnosed cancers in men, with nearly 1 in 6 men being diagnosed at some point during their lifetime. Thankfully, when detected early, most prostate cancers can be cured. Most importantly, men with a family history of prostate cancer, especially in a father or brother, and men of African descent are at higher risk and should discuss screening for prostate cancer starting in their 40s. Certainly, age is one of the most important risk factors for developing prostate cancer, and guidelines recommend standard screening starting around the age of 50. Prostate cancer screening is performed with a PSA blood test. PSA stands for prostate-specific antigen and is an enzyme that is produced by the prostate. An elevated PSA does not necessarily mean you have prostate cancer, as a PSA can be elevated due to benign enlargement of the prostate or even due to infection. Next, bladder cancer is a potentially more lethal type of genitourinary cancer. The most significant risk factor for developing bladder cancer by far is smoking. A history of chemotherapy or pelvic radiation, or a history of work in textiles and manufacturing, especially in a factory setting, can also increase your risk of developing bladder cancer. The most important sign and symptom of bladder cancer is painless blood in the urine. Blood in the urine is never normal, and if you ever notice blood in your urine, you should discuss these findings with your doctor, who will likely refer you to a urologist for further evaluation. Other less common but also concerning symptoms of bladder cancer may include increased urinary frequency, pain with urination, or worsening lower back pain. Finally, I'd like to talk about BPH, or benign prostatic hyperplasia. This is a benign enlargement of the prostate, which is very common in men, especially after the age of 50. The most common risk factors for developing BPH are a family history, men with obesity, and having a sedentary lifestyle. BPH becomes exponentially more common as men grow older, especially after the age of 60. The most common symptoms of BPH are urgency and frequency of urination, frequent nighttime urination, a weak urinary stream, and even occasional incontinence or leakage of urine. The good news is that BPH is a highly treatable condition, either with medication or minimally invasive surgery, and you should definitely tell your primary care doctor if you're having any of these urinary symptoms. In summary, it's important to know your family history so that you can share this important information with your doctors. If you have a family history of prostate cancer, be sure to talk to your doctor about the right time to start PSA screening. Remember, blood in the urine is never normal and should be discussed with your doctor. Thank you for your time, and I wish you good health.